Testosterone injections are one of the most effective means to deliver testosterone replacement therapy. There are a variety of different types of testosterone, bioidentical testosterone. All of these kinds of testosterone injection provide the same activated form of testosterone, but are chemically combined with different releaser products which slow down the rate at which the testosterone is absorbed by the body. Some formulations of testosterone injection take 2 weeks or more to release the entire amount of testosterone in a single injection. With the help of injectable testosterone, it is possible to overcome the effects of testosterone deficiency to improve quality of life and enhance health and longevity. Low T is a significant medical condition which many argue is underdiagnosed and undertreated in America today. How much testosterone do I need per week? Dependent upon the dosage and the formulation of the testosterone, each testosterone injection will range between 50 to 300 milligrams per shot. The goal of testosterone replacement shots is generally to provide 100 to 125 milligrams of testosterone per week. The exact amount will be up to your hormone replacement therapy doctor, who will prescribe you a testosterone dosage designed to fit your unique personal needs. All forms of esterized testosterone are delivered intramuscularly, and most are given in an oil suspension. The most common suspensions are sesame seed and cottonseed oil. A minority of patients may be allergic to one or both of these forms of oil and may need to choose a different oil suspension. In this case, the medication will likely have to be created in a compounding pharmacy. What are testosterone esters? Esters are inert compounds used to slow down the rate at which the body absorbs bioidentical testosterone medication. The ester compound is joined with the testosterone, and the bond between the two components slowly breaks down over time. The length of time that testosterone stays in one system is dependent upon the size of the ester. The more significant that the ester compound is, the longer it will take to distribute the medication. In simple terms, this means that the larger the ester, the fewer injections that you have to endure. The most popular injectable testosterone products are long-chain esters because they present less hassle while still providing quality HRT results. The two most popular forms of testosterone replacement therapy today are testosterone cypionate and testosterone enanthate. Testosterone cypionate. Testosterone cypionate is a favorite type of esterized testosterone, which releases into the bloodstream for 3 weeks. Testosterone levels are at their highest in the first 2 days, and the injection provides 12 days of sustained release. If you order this type of testosterone from a name brand supplier, it's named Depot Testosterone, but it is possible to get this kind of testosterone as a generic medication as well. Depot Testosterone is a cottonseed oil suspension. Testosterone enanthate. This form of bioidentical testosterone shot is an ester compound which slowly delivers the medication to the body in a period of 8 to 10 days. This form of testosterone is available in generic form, but the American name brand formulation of testosterone enanthate is delaestrol. The generic form can be mixed in any approved oil, but delaestrol is only available in sesame oil. Testosterone phenylpropionate. This form of testosterone is less common than cypionate and propionate, and is designed to provide a testosterone dose which lasts 3 to 4 days. The most common non-generic form of this testosterone is Testolant. Testosterone propionate. Unlike testosterone cypionate and testosterone enanthate, testosterone propionate dissolves into the body fairly rapidly, in 2 days generally. Viromone and Testovis are the most common brand names of this type of testosterone. This form of testosterone has a higher incidence of irritation and pain around the injection site, whereas most other common types are much less painful. Liquid suspended testosterone. This is one of the rarest forms of testosterone replacement therapy because it requires daily injections, and the body burns through the testosterone very quickly, immediately upon injection. This kind of testosterone is not connected to any ester, so there is no mechanism by which to slow down absorption. Aquaviron is the brand name for this testosterone treatment. Mixed testosterone treatment. There are many independent testosterone formulations which utilize mixes of different testosterone esters to provide an optimal release of testosterone over time. Every form of testosterone has its own timeline of release, and some types of testosterone work very well together and create a streamlined release of the hormone. The goal of testosterone therapy is to mimic the body's natural release of testosterone, to avoid a physiological process known as tachyphylaxis. Mixed testosterone helps to prevent the highs and lows sometimes associated with low-T injection therapy, and also protects against the body increasing its resistance to testosterone. Are you interested in low-T injections? We can help. Our medical clinic specializes in a wide variety of hormone therapy treatment options, with a particular emphasis on testosterone. We provide a full array of testosterone injection brands and products, and we also offer other forms of testosterone, including testosterone patches, gels, and creams. If you believe that you may be a candidate for testosterone optimization for low T, or if you are just looking for a reliable and affordable supplier, we encourage you to contact us for more information. Just go ahead and click the link below in the description of this video and give us a call or fill out our contact form.